Hi everybody, it's Dr. Newman. I want to talk a little bit about incision size when we use saline implants versus using silicone implants. Typically, saline implants can go in through a smaller incision because the implants, when we receive them, they're empty. I can put that implant in and inflate that implant when it's already inside somebody, and therefore I can put it in through a smaller incision. Whereas a silicone implant comes from the company inflated. A Keller funnel has allowed us to use a slightly smaller incision than we used to, but if a silicone implant is placed through too small an incision, then the force required to put that implant in, since it's already an inflated implant, is just an extreme force, and if the incision is too small, you can really damage the implant while placing it. Before funnels existed to insert the implants, I found that many ruptured implants that I would see, if I looked at the scar that was used, that scar was usually a very small scar, much smaller than I would expect, and I think that that probably contributed to the rate of ruptured implants that I would see when I would see patients in my office. But now that we have a Keller funnel, we're able to use a smaller incision than we used to, but it's still a larger incision typically than an incision that's used when saline implants are inserted.